Hi, my name is David Dolan. I'm a nursing director for a thoracic surgical department at a major Boston teaching facility. I'm here to show you the application of the Gentle-One dressing. Unfortunately, we weren't able to get you a live patient, but we do have this lovely dummy here for you. Here I have the Gentle-One dressing, the #1 starter. In this dressing includes a starter and a cover. And this is for a single thoracic tube use. And I'm going to show you the preparation and application of this dressing. First, we want to make sure that the area around the tube has been prepped. Next, we open up the dressing and make sure that this is a single thoracic tube dressing. You take the paper back from the base. And as you're doing this, make sure that you slip it around the tube. And then you want to make sure that the hydrocolloid gets warm against the patient's skin, because when the hydrocolloid is heated, it adheres better to the skin. So you gently press around the edges to make sure that all the folds are evened out. As you can see, it secures the thoracic tube very nicely. You want to make sure that it's very adherent to the skin. We also have another option for you. We have another hydrocolloid strip that goes across the seam to give you more closure. You can do it on the absorbent pad, and then you can do it on the base itself. Now I'm going to show you the changing of the #2 cover dressing for the Gentle-One. Recommend that you change the dressing when it's saturated or when it looks like it needs to be changed. The good thing about the #2 cover dressing is that it never touches the patient's skin. The base, which is the hydrocolloid base, can stay on the skin for up to 7 days. So when you go to remove the dressing, you just peel the #2 cover away from the base and remove it. You take the #2 cover, remove the backing, and we would like you to put the slit moving upward against the base, away from the bottom slit. Just gives it a little bit more adherence and protects from drainage. As I mentioned before, the hydrocolloid base can remain on the skin for up to 7 days. When the hydrocolloid base is removed from the skin, it comes up very easily and there's no irritation or to the skin or any redness or damage to the skin. Advanced Patient Care has come up with a dressing that can accommodate multiple tubes in one place. I'm going to show you how to apply this dressing. It's applied like the 4x4 dressing. Peel the tape off the hydrocolloid. Identify where your multiple tubes are and place the perforated edges along the tube. You want to make sure that you smooth out the hydrocolloid just to heat it to the patient's skin so it will adhere better. As you can see, it fits 2 tubes very nicely. Recommend that you change the #2 cover when the dressing's saturated or you think it needs to be changed. Make sure that you hold down the hydrocolloid base as you remove the cover. is not to take off the hydrocolloid off the patient's skin. The one good thing about this dressing is the cover and the tape does not touch the patient's skin. You simply take a number 2 cover, remove the edges. We recommend that you put the slits going up towards the other side and place it right on the hydrocolloid base. Not touching the patient's skin. So when the chest drain is removed, you want to apply an occlusive, clear